A lot of people go all the time, or they feel like they have to swallow all the time because they have this mucus going in their throat. Right now, I have that because I've been traveling on planes, going for lectures all over the world. So airplanes can produce that, but a lot of people really get this. And it frustrates a lot of people just by being with these symptoms. And sometimes we don't have real solutions, or people just get used to it, or people think, well, it's normal. You know, I'm seeing patients and you go, do you have any previous disease or any antecedent? And they go like, yeah, well, I have rhinitis, and I always need to clear my throat, but I really don't know what's the matter, but I think it's normal. No, it's not normal. It's not normal to have symptoms. It's not normal not to feel well. So in this video, I want to tell you which are those reasons or those causes that you can go and look that are causing you that necessity to clear your throat, to be coughing all the time, to have this mucus production that's always in your throat, just making it so uncomfortable. So let's get started and let's go and see that the first reason why you might have this is because you're dehydrated. Let's stop here for a moment and let's remember what is to have a good hydration. Because having a good hydration, it's not just by drinking water. Drinking water, it's important. Of course, it's a part of hydration. But fluid, water, needs to go from your intestine into your bloodstream. Then it needs to go to your cell. But before it gets to your cell, it's going to get within your cells. So those three spaces inside of your blood, outside of your blood, but within the cells and inside of the cell, those three spaces are the ones who determine if you're hydrated or not. If you're well hydrated, it depends if you have fluid in those three spaces. If not, then you're not well hydrated. And what is the factor that depends on that? Is it just water? No, it's water and minerals. If you take good amounts of minerals, especially sodium, potassium, and magnesium, it doesn't mean that necessarily you need to be taking a supplement. No, it could be that you are taking the right amounts of sodium, potassium, and magnesium in your diet, and also you're taking the right amount of water, then you're going to have a good hydration. The other very common cause is when you have an infection. But having an infection, you need to stop also and wait for a moment, because some people, they have access to antibiotics, or they kept an antibiotic that was prescribed maybe somewhere in the past, or to a neighbor, or to a friend or something. And whenever they see mucus production, they say, oh, I'm gonna have an infection. I'm gonna have an antibiotic. Let's remember that we could have viral or we can have bacterial infections. Of course, they could be fungi, but most commonly we have viral or bacterial. I mean, we all can have fever. We all can be dehydrated. We all could be feeling bad, nauseated with headaches, a bunch of things. But from the mucus production, how can I know if it's more prone to be a bacteria or it's more prone to be a virus? Whenever you have green mucus, green phlegm, it doesn't mean that it's bacterial. They're a part of the white blood cells that is called the neutrophils, and neutrophils have a byproduct that is going to turn the phlegm into green, light green. So if you have light green production of phlegm, of mucus, it doesn't mean that it's bacterial, so you don't have to worry at all thinking that it's bacterial and that you need an antibiotic. No. When the mucus is turning dark green, very dark, turning into yellow or turning into brown, then that is bacterial. Or when it smells really bad, that bacteria are producing different gases and it's turning into different production of byproducts that is going to make it smell really bad. So we need to differentiate, but still, again, if you think that you have that, please go and see a physician. I really want to encourage you not to go for auto medication. And also, if you for any reason get prescribed an antibiotic, and no one prescribes you a probiotic, please go and get it by yourself. Other very common cause is what I have right now, and it's something that is going to irritate your respiratory tract. I have it because of airplanes. The air inside of airplanes is very dry. So you get very dry and irritation because of the dryness. So that's why I'm coughing all the time. I've been coughing for the past 2 weeks. And I've been also with that need of clearing my throat. It also could be because of smoking or because of vaping. We just did a video from vaping. If you haven't seen it, please, I encourage you to go and see it. Really, vaping, it ain't safe. It's not good at all. It's not just glycerin coming into my lungs and then going out. No, but anything, maybe going to a concert, going jogging early in the morning, jogging late at night, something that is going to cause irritation is going to cause inflammation and a high production of mucus and a high production of water. So that could also give you that same feeling. But I want to talk to you about what I've seen that it's probably the most common cause for this. And it's not coming from your mouth. It's not coming from your lungs. It's coming from your stomach. It's when you have chronic reflux. You might think like, but people, when they have reflux, they know because they have pain. They have heartburn. No, most of the people, when they have reflux, they don't have heartburn. What they have is every other symptom. One of them, it's having all that mucus production or coughing during the day or coughing at night. Why? When you don't have a good stomach, let's remember that the stomach needs to be acidic. The pH of the stomach is in between 1 and 2. That's the normal pH of the stomach. The pH of the stomach, as it goes closer to 1, it's more acidic. As it goes closer to 7, it's less acidic, but still acidic. The contraction of the lower esophageal sphincter depends on the acid. So if I don't have enough acid, it's going to dilate. And let's put it this way. We have here the esophagus. Here it's your head. And here, down here, it's your stomach. If you have a dilated esophagus, then every time you're contracting the stomach because you're starting to digest, because that's what the stomach does, you're going to have reflux because it's going to be pushing all that content up and up and up and up and up. And you might be just sitting at the office, just waiting, just working, doing whatever, and you're going to have reflux. But what happens when you go and you lay down to watch Netflix or just lay down to bed? You go and you lay down, same example, it's going to turn out. So all this gastric content might start to migrate into your mouth, going up the esophagus and going into your mouth, going up into your sinuses. So when people have chronic sinusitis, it could be a sign of a chronic night reflux. It's a very common cause. And again, the treatment, it's not with antibiotics. The treatment is by treating reflux. And this is probably the most common cause that no one is talking about. And that no one is giving people tools so they can do something about it. We have a lot of videos, and I encourage you to see this one, in which you can understand how this stomach works and how you can fix it. Fix it in a natural way without any medications. People all over the world coming and saying to me, hey, I watched your video on recovering the gastric acid and my gastritis went away, without being my patient in my office just sitting with me. Again, try to stop for a moment and try to see which is your condition. Is it something acute? Is it something chronic? Is it something chronic that has gotten worse? Is it something that it's been forever like this? Again, please remember that this is not normal. Please remember not to self-medicate. Please go and see which are your causes. If it's something infectious, go to your physician. If it's an allergy, go to your physician. If it's gastritis, I encourage you to watch the video, but also go and see your physician. Get an endoscopy. Go and talk to him about this treatment. And remember that the treatment for reflux, it's not using PPIs. Actually, they're going to worsen because they're going to turn your stomach into being less acidic, and the esophagus is going to be wider, and you could even have more reflux than the one you had before. You treat at the beginning if you have a very high irritation or an ulcer, and then you start recovering your stomach into the normal way. So again, guys, before we leave, this is information that could be useful for a lot of people. Please don't make symptoms normal, ever. To you, to your family, ever. We should enjoy life. We should be able to enjoy our body. And that's something that we regain when we become the owners of our health. Again, that's the only purpose of this channel. And before I leave, please remember to share this video with your contacts. Please also remember to hit the like button, subscribe to the channel, and if you haven't done so, to click the bell. So every time that we make new videos, you're going to be the first one to be notified. Thank you so much, and I'll see you next time. Perdón, justo puse grabar y me dio tos.